Hi, Dr. Robert Selig, and today I want to talk about some of my favorite therapies that I like to do in-house. And the two therapies I'm talking about is exercise with oxygen. So the oxygen is my oxygen concentrator, which is delivering 5 liters per minute of oxygen. And oxygen is amazing for the brain. So all your tissues need oxygen. Every cell in your body needs oxygen. So when we're seeing a lot of neuropathies and a lot of stagnation and just a lot of things where the energy is low, oxygen therapy can fit into any plan. And my favorite exercise happens to be the Rebounder. This is a NASA-approved machine, meaning that when the astronauts come back from space, you notice that they wheel them off on stretchers because of their bones become so osteoporotic due to lack of gravity up in space. The first thing NASA does is put them on the Rebounder. So when we combine oxygen with exercise, we have an amazing 1-2 punch. So we gently hook up. Every patient gets their own little cannula, and we hook this up, and we get a nice flow of oxygen, and we slide the shoes off. We put the music on, and the patient will get on the Rebounder and will exercise. Now, when we exercise with oxygen with the Rebounder, we slowly get into a nice rhythm. And so I have the bar here for patients that may have some kind of balance problems, but if you don't have a balance problem, I'm encouraging people to really let the rhythm flow. So this is not a mechanical exercise. Like most exercise become very mechanical. This exercise becomes intuitive. And so I'm taking off the oxygen so I can actually talk a little bit better, but you will have the oxygen cannula on while doing this therapy. But for the sake of demonstration, so I can talk a little clearer, we're just assuming that is on. Now, when we exercise, this is the greatest lymphatic mover that I have ever studied. So when we move lymph tissue, that's basically the garbage collector, moving all the toxins out of our body. So we get into a nice flow. We start maybe shaking the body, getting the blood, the lymph moving through the system. And when you start doing this for a couple minutes, you go from the beta stress waves into the alpha relaxation phase of the brain. So you get into parasympathetic mode. You start training every cell in your body. And the G forces on this are amazing without the compressive forces to the feet. So the technology in the Rebounder is so that you will not pronate and supinate. You will not put too much stress to the bony architect because of the advanced technology of this machine. So I'll have patients, they're getting their oxygen coming in, they're rebounding, they're listening to music, going into alpha state, training every cell in your body and moving lymph. This is the beauty of this exercise, and most importantly, it's fun. You get on this and you just start feeling good. Now, that's a beginner type of thing. In the more advanced phases, I'm going to teach my patients more on how to do the bone tapping while we're doing the exercise. So we're opening up the lymphatic channels here, we're pumping the thymus here, we're tapping along here. So we're really starting to engage in a lot of activity. So we're slapping the body, we're strengthening the bones as we get into the slap, we're hitting the liver, we're hitting the spleen, we're hitting the stomach. So we're doing like multiple things with one exercise therapy. And the oxygen is really an incredible part. And I could actually work up to 10 liters per minute. Again, I would bring in my other machine and we would hook the dual machines up to get the full 10 liters. But initially, I always start my patients at 5 liters per minute, usually 20 minutes of the rebounding to get things moving. And just wanted to introduce one of my all-time favorite exercise therapies that is really worth its price in gold. And again, this is just the bounce, and the health bounce we call it. And when we get more advanced, we can start jumping, and we start really increasing the G-forces. We start really getting the blood and lymph moving. But initially, just having people move lymph, move blood, exercise every cell in your body with the simplest, easiest, funnest way to exercise with the rebounding. Truly a remarkable therapy, and will turn all my patients on to this most amazing therapy because, like I said, it's fun and really seals the deal in focusing on moving the lymph and training every cell in your body. So that's just a brief introduction to exercise with oxygen therapy using my favorite exerciser, the Rebounder. Thank you for watching.